So, doctor, do you actually suggest an age for the girl or the guy to get married?
See, it's basically getting married. There's been always a question as what is the correct age to get married. It is never the correct age to get married. It's basically the correct age to get a baby.
Mm-hmm.
So the female body is made in such a way that the correct time to get pregnant and deliver, the most apt time is around, say, 18 to 24 years. That's the most apt age. So that is why it's considered as the age to get married than to actually. That is why it's always called as the best time to get married.
Now, I'm sure there are many girls out there who are past the 25 years.
Yes.
What risk are they running?
No, it's not basically the high risk. See, currently with today's social problems around, you always, majority of them get by the time they finish their postgrads or something, it's almost always 25 plus and they get married.
Mm-hmm.
So it's not that they're at a higher risk. Just basically saying that they're going into a term wherein they need to go aggressively more in for once they get married, they need to go in aggressively and try to get pregnant at the earliest. And another reason what generally happens, what we see is basically that they kind of try not to conceive for 2 to 3 years post marriage, and then just immediately after that, then when they start trying and then they don't get pregnant, they start panicking.
Mm-hmm.
So that should not be left out for a long time. Basically, after a year or so, you should start getting pregnant even if you're married after 25 plus. And once you start trying for it and then do not get pregnant, you need to come in early for a treatment. Like I said, post in 1 year, they should actually start treatment. Or somebody who's 30 plus, you should actually start treatment after 6 months. This is what is ideally told.
Can you tell us more about the various treatments that can actually correct?
See, there are several treatments available in infertility. See, and time, we believe, is one of the major reasons, major treatment options of availability. You give them time properly, that itself will give them time to get pregnant.
Mm-hmm.
And when it comes to invasive, that is treatment procedures, like you have early procedures like IUI, where it's called intrauterine insemination. That is, once we actually give medicines for these females to produce eggs, and once we actually monitor these eggs over the ultrasound, and once we're sure that the eggs have developed to a good size, we give them injections for that eggs to rupture.
Mm-hmm.
And once we have confirmed that the eggs are ruptured, we take in the husband's semen, wash it, and get the best semen quality in that, and then inject that sperm into the uterus. It basically is one of the early treatment options available for infertility when they're not conceiving for a long time, and they have specific reasons like some problem with the sperm count or some other unexplained factors in this as the causes of infertility.
So, for instance, if a couple is have tried before and the wife is 35 years
Mm-hmm.
plus, for example, and if they're not getting a baby, if she's gone through 2 or 3 miscarriages already, can she actually have a baby?
Oh yes, we have documented evidence of people even getting pregnant even after 40 years. But just that, see, your chances, what generally happens is beyond 35 years or beyond 40 years is that, see, your chances of getting pregnancy reduces. And once they get pregnant, your chances of having an abortion increases. And once, if they do not get aborted and they keep continuing, the chances of them having an abnormal child also increases. And it's only that very small group of patients in the end who
Mm-hmm.
survives all these barriers and comes and will have a normal child.
Okay.
So that is a whole. So we have a lot of patients who come to treatment beyond 35 and who conceive, but that the whole understanding that they need to come in for treatment early is not. See, they would have had a better chance of pregnancy if they had come earlier,
Mm-hmm.
say before 35. But then if they come in later, then the chance of pregnancy are always slightly on the lower side. And generally what is done is basically that even after an IUI, the patient is not getting pregnant, and you're not able to identify any particular reasons. The next line of management is to a laparoscopy, like I said, a keyhole surgery. And we basically do not do a laparoscopy to treat something. It's basically done to make sure that everything is all right.
Mm-hmm.
And if at all there is a problem, then we can correct it also through a laparoscopy. And once you're able to correct it to a good extent, then only we repeat IUIs further. And if they're not pregnant, then only we go into the next step of a treatment called IVF. IVF was basically called the test tube treatment, what common people know. It just tells us that the both, like I said, the eggs of females and the sperms of the male are taken out from both the bodies, and it is kept outside and fertilized. That's why it's always called a test tube treatment. So in IVF there are several treatment options available today. There are something called plain IVF, wherein actually you just put the sperms and eggs together in a dish. They become an embryo, that is, they become a small child, and then once we have that small child, we put it back into the uterus, or the uterus of the mother, and then they stay back. There even options are available currently called ICSI. That is, when IVF was initially started in 1978, that was the first IVF baby born in the world called Louis Brown. And at that point of time, actually, they took almost 20 years for that first baby to be born. And they had done almost, say, 2,000, 3,000 cycle treatments, and they got one baby. And it took almost 3 years after that first baby for them to get the second child. At that point of time, the IVF treatment, the results were, say, 2 in 5,000. And that is extremely low success rate. And over that thing, there are several treatments started coming in. So with the current scenario, with plain IVF, the results are supposed to be, say, 20 to 30%. But in 1995 time, there was an introduction of a treatment called ICSI. It's called intracytoplasmic sperm injection. That is, what they do is, there's an egg and there's a sperm. They'll take one sperm and inject it into one egg, and make a baby out of it. So your chances of having a baby slightly goes higher. So that actually revolutionized the way infertility is taken throughout the world. Initially, infertility was considered as a treatment which got very less success rate. Like I said, you needed a lot of money, but with the coming of ICSI, the success rate went up as high as 40 to 50%. And like I said, this is some very a point which everybody has to remember. Like I said earlier, a normal couple has only a 20% chance of getting pregnant in a month normally, and even we take them and do an IVF treatment on them, we do not get a success rate of more than 40 to 50%. And this particular idea should be put into each patient's mind when they start a treatment. There's no treatment available which has got a 100% success rate. There is no treatment option available. They say that even after doing everything manually, like taking the egg out, making a embryo and putting it back into the uterus, why or when that embryo catches inside the uterus is still not been explained. There are several, 10 years down the lane, we might have a 70% success rate. But currently today, all around the world, it's not only about in India or in our center. Basically, all around the world, the best success rate possible is around 40 to 50%. And beyond that is still not considered as a success rate beyond that. And like I said, ICSI is, with the advent of ICSI, like I said, the success rate is now up to 40 to 50%.